We are continuing to monitor the latest numbers in the COVID-19 pandemic in our region, including new cases, hospitalizations, and deaths. Here's the latest from Ballad Health today. The healthcare system says they have 234 COVID-19 patients in their hospitals, 30 fewer than their last report on Friday. 69 of those patients are being treated in intensive care units. 54 of them require the use of a ventilator. Ballad says they've had 80 COVID-19 related deaths at their facilities over the past 7 days. Joining us now is Dr. Mark Wilkinson. He's the Vice President and Chief Medical Information Officer for Ballad Health. Thank you so much for joining us today, Dr. Wilkinson.
Thank you, Sarah. It's a pleasure to be here.
Well, first, I'd like to get your reaction to those latest numbers reported by Ballad today.
Well, we are optimistic in the steady decline for the inpatient COVID-19 numbers. However, we are still concerned because of the relatively low vaccination rate and continued public activities, obviously, in closed spaces without masks quite commonly. So those dynamics lend themselves to a continued census in the 200 range for COVID-positive patients in our facilities.
Well, after several weeks of a rise in new cases in the region, those numbers have dropped again. So does this trend concern you? How do you feel about this?
Again, we're happy with the trend. We feel as though it's a combination of factors. The vaccination numbers are up slightly, although not as high as we want them to be. We also have been giving quite a few doses of monoclonal antibody, which does help prevent the severity of the disease and keeps people out of the hospital. And then, of course, we're monitoring patients at home, too, so that cuts down on numbers of people that need to be admitted to the hospital. So we've got some activities underway, of course, which are helping those numbers come down. Unfortunately, the death number, which you had just shown, is quite alarming. We're having, of course, over 10 deaths a day still. And so that does contribute to the lower numbers of inpatient stays, unfortunately. It's still not a good sign when people have to be in the ICU and get on a ventilator. That typically is not something they can overcome easily.
Something that a lot of people are talking about right now is the booster shots. Pfizer's vaccine booster has been approved. Moderna and Johnson & Johnson are waiting to get approved for this booster. Are you hearing anything regarding when people could be receiving these shots and when they could start getting that extra dose?
Yes, so already individuals that had the Pfizer vaccine series, the 2 initial doses, are eligible for a booster dose after 6 months or so. So those that are of an older age, over 65, those that are immunocompromised, those in the healthcare profession, should go ahead and get those booster doses as soon as they can with the Pfizer vaccine. So we're currently actively immunizing our team members within Ballad Health. So we're actively immunizing with booster doses across the health system now and offering that to those high-risk populations in our mall-based clinic.
Something else.
It's also available at pharmacies locally, too.
Okay, great. Something else people are talking about is an antiviral pill that is supposedly help against COVID-19. What could this antiviral pill mean in the fight against COVID?
It is wonderful news recently announced that this may become available once the FDA has gone through its review of this medication and granted emergency use authorization for that also. That would help us with our folks that do turn COVID positive. They can take a pill now, and that would be the only oral medication approved for use in COVID positive patients. As you know, currently we're offering the monoclonal antibody therapy also, which is either IV or subcutaneous. So this will be the first pill form of a COVID treatment drug to date.
A lot of parents are excited about the possibility of children ages 5 to 11 possibly getting to be vaccinated in the coming weeks. Have you heard anything new on that front?
We have heard that maybe by as soon as Halloween, October 30th, we'll have approval for the use of Pfizer in the pediatric population, age 5 to 12. We currently offer that vaccination course from ages 12 and above, but the addition of the emergency use authorization for ages 5 to 12 is exciting news. That does mean, in essence, that our school kids would be able to get vaccinated against COVID-19. Something I wish was available actually, sooner in this pandemic than later. because we've got a lot of sick kids, unfortunately, hitting our hospitals with COVID-19. So it'd be nice to have that vaccine available for them also.
That is true. Now, speaking of Halloween, it's coming up in a few weeks. Do you have any advice for parents and kids as the trick-or-treating questions start coming about and the excitement of Halloween comes?
Sure. The nice thing about Halloween in many ways is that you tend to be outside, trick-or-treating from house to house, and so there's some social distancing involved, of course. We do still advocate for mask wearing for our children. We incorporate that as part of the costume, obviously. And then, of course, remember good hand hygiene and just play it as safe as possible. We don't, of course, condone families getting together in enclosed spaces because some minimally symptomatic patients can spread COVID easily with this Delta variant, so we don't advise, again, cohorting as families in an enclosed space, but trick-or-treating outside is a wonderful thing, but masking is still recommended.
Dr. Mark Wilkinson, Vice President and Chief Medical Information Officer for Ballad Health, thank you so much for joining us and answering our questions today.
You're welcome. Thank you, Senator.